My name's Tracy Gale and I'm the Service Support Manager for Paediatrics within Hywel Dda, and this encompasses line managing the secretarial and admin staff. An overview of the service we're providing is that we are Paediatrics and we cover acute and community patients across 4 sites across the 3 counties. Before the pandemic, services were delivered predominantly through face-to-face contact with occasional telephone calls from consultants to patients. When the pandemic hit, we had to stop seeing all patients face-to-face and bringing them into the hospitals. So the introduction of Attend Anywhere has been really good because it's enabled the consultants to resume clinics and see patients without having to bring them onto the hospital sites. The challenges of bringing in video consulting software has been that all the staff have had to have new training. Previously, our appointments were booked in another department and our secretaries have had to now start booking them themselves. The challenges to patients has been that there's a new way of accessing their healthcare. Also, it's becoming more familiar with the new technology. Not all patients are familiar with new technologies and not all of them have used video calls before. The benefits of bringing in the video consulting software has been that we've brought in fewer patients to hospital sites and to clinical areas. The consultants have been able to see patients more flexibly, either in their office or the clinic rooms, and we've been able to offer more flexible appointment times. In the future, I can see that video consulting will continue to be used and will become more popular and be used far more often.